My name is Billy Golden. I am with NASTAD. I'm also joined by my colleague, Meredith McCarthy. The topic for today's conversation will be federal funding and programming for housing services. We'll discuss what harm reduction service providers and advocates need to know about federal housing programs, how they can connect with local agencies or providers, how to advocate or collaborate for best practices for drug user health. We're joined today by our speakers, Will Ramirez and Joy Rucker. Will is joining us from the CDC's Office of Overdose Prevention under the National Center for Injury Prevention and Control. Joy has a long history in harm reduction and housing work, starting in Massachusetts, but Joy is now currently working on implementing housing first programs in the Hawaiian Islands. Just a little bit of housekeeping before we get started. We are back to using Zoom for anyone that was in our previous webinar. And this Zoom has an increased capacity, and this is what we're using for the rest of the series. When we get to the Q&A portion of our conversation, you can raise your hand, use that feature if you want to ask the question verbally, or go ahead and type it in the chat box, and we'll read it out loud for you. And Meredith, is there anything you'd like to add?
No, I think we're all set.
All right, well then I'm going to go ahead and pass it to Will. Thank you.
Thank you, Billy. Thank you, Meredith. Good afternoon, everyone. My name is Will Ramirez. I am extremely excited to be here today to talk about this topic for which I'm very passionate about. So I know Billy gave me a brief introduction, but I just want to give the whole spiel. I am an ORISE research fellow with the CDC's National Center for Injury Prevention and Control in the Division of Overdose Prevention. And today I'm going to give like a brief overview of harm reduction approaches in federal housing programs. So I want to start by providing a little background of my experience in this space. You know, before I was an ORISE fellow at the CDC, I worked for a nonprofit in the city of Atlanta that advocated and crafted policy for persons living with HIV and those in the LGBTQ plus community. You know, it was there that I was introduced to the concept of harm reduction, specifically harm reduction in housing. This included working with the Department of Housing and Urban Development's Housing Opportunities for Persons Living with AIDS, which is a HOPWA federal program in Atlanta and the surrounding metro area. Now, this program is the only federal housing program dedicated to providing rental housing assistance for persons living with HIV. Now, we know that being unstably housed exacerbates the health implications of a person. So due to that, part of my work was to ensure that there's equity within the housing stock available to persons living with HIV, and that provider organizations were instituting housing first principles. Housing first is a principle that uses harm reduction in its implementation, and we're going to go further into housing first throughout our conversation. My work revolved around coalition building, advocacy, and policy crafting within the Atlanta metro area. This work is important in Georgia, as the National Alliance to End Homelessness showed in their 2021 State of Homelessness, in their Georgia report, showed that approximately 10,234 people were experiencing homelessness in Georgia on any given night. In Atlanta, that number was around 3,240 people on any given night. So, as I mentioned earlier, homelessness and housing instability, they lead to poor health outcomes. In 2009, the Bureau of Primary Health Care at the Health Resource and Service Administration, which is HRSA, conducted a health center patient survey where they assessed the data on patients who used health centers that received federal funds. This data ended up showing that this data provided a comparison of health conditions between persons experiencing homelessness and those who were housed. The data showed that substance use disorders were 58% more prevalent in populations of persons experiencing homelessness compared to 16% who were housed. Now, this discrepancy showed a dire need for harm reduction to be included in how we looked at housing. As homelessness and substance abuse are deeply tied. You know, HUD in 2014 released a report called the HIV Care Continuum, where they identified the importance of housing and health outcomes. The report stated that housing status was found more significant than individual characteristics as a predictor of healthcare access and outcomes. You know, this showed us that recovery and healing are more difficult without stable housing. Now, housing programs are usually offered in two forms, either temporary or permanent. You know, temporary housing includes housing such as emergency shelters and transitional housing, which is like short-term living arrangements. Now, permanent housing is exactly what it sounds like, and the housing first approach is a method to achieve just that. It's defined as the placement of persons who are impacted by housing instability or homelessness into permanent housing. And it's different from housing readiness, because with housing readiness, a person is given housing after showing attendance or adherence to drug treatment programs, mental health visits, and actively participate in job seeking or training activities. Now, with Housing First, those services are offered after the person is housed. And the participation in those services is completely voluntary and up to the person. Now, the Housing First approach is a way for us to see harm reduction in action. You know, it may look different depending on who is implementing it, which state is implementing, what organization within that state, what municipality. It can look different, but the essentials of Housing First always remain the same. You know, and those include the following four. You know, the direct or nearly direct placement of targeted people experiencing homelessness into permanent housing. The program, like I mentioned earlier, does not require participation in supportive services offered so that you can remain housed. The use of assertive outreach practices to engage or offer housing people experiencing homelessness with mental illness who are reluctant to enter shelters or engage in services. So it's that community outreach. And then the fourth one is the continued effort to provide case management and to hold housing for clients, even if they leave the program for short periods. And all that information is provided to us by HUD. You know, HUD has been really engaged in creating programs or providing resources centered around Housing First. They have this initiative called their Continuum of Care programs, which have implemented a Housing First approach. You know, within their website of the Continuum of Care, they offer a variety of resources for organizations that may want to start providing housing using this Housing First approach, and therefore applying these harm reduction in these services. Within this website, you can find implementation guides for Housing First principles, as well as a checklist to ensure that if you're an organization that wants to implement Housing First, that you are applying the approach correctly. Now, there's a vast of other also available resources that include like overview of different programs that exist throughout the country, how to engage effectively with the community when you're trying to implement or develop Housing First programs, and the delivery of how to deliver services such as trauma-informed care and other harm reduction related services. And as I get to the end of I guess my overview, there's a specific program that was created by collaboration between the Department of Housing and Urban Development and the Department of Veteran Affairs. And they called it the HUD-VASH program, which is the Department of Housing, Urban Development, Department of Veteran Affairs, Supportive Housing. And this was a collaborative program between these two agencies to implement harm reduction in housing, specifically for veterans. This was implemented back in 2011 at 14 different HUD-VASH sites. And this became the first Housing First pilot initiative for this organization. Now today, HUD-VASH has assisted over 90,000 veterans with housing vouchers, and it works collaboratively with over 130 public housing authorities across the nation, in which when they're working with them, they all have to implement the Housing First model. So that's like a brief overview of just the vastness of how these programs can be used and how agencies like HUD and VA have learned to implement these programs in our communities. Now I'll open it up for any questions or pass it over to Joy, actually.
Good afternoon, everyone. Aloha to folks from Hawaii. I'm currently in Maui. I'm sorry I can't access the chat. I'm using my sister's computer. It's not an Apple, so I'm all confused. But anyway, and I know there's a bunch of folks on here that I know from harm reduction and housing. So thank you for, there are other experts on this, participating in this workshop as well. So I've done housing for a long time. I started doing housing in San Francisco in the 90s and created a transitional housing program for people that had HIV and substance use issues. And it was called the Rafiki House, and it was run by Black Coalition on AIDS. And actually we won an award from HUD for being a project of national significance. And then I started working for Corporation for Supportive Housing, and they introduced supportive housing to San Francisco. And supportive housing really is taking people that have been chronically homeless and providing services on site to folks that will allow them to remain housed. Now, the great thing about working in supportive housing and understanding harm reduction is that prior to harm reduction, services were mandated. They were tied to the person's subsidy or their ability to remain in housing if they participated in services. And so we worked very hard to change that services cannot be connected to your ability to stay housed. If you decide you do not want services, you cannot be kicked out of housing. So to understand where housing has come from and where it is now, that people that provided housing for people that were chronically homeless and had substance use issues and mental health issues would lay a program on top of program requirements on top of housing. And you cannot do that. It's against the law. In order to stay housed, all you have to do is pay your rent and not be a nuisance. And so people would evict people or kick them out of housing, not evict them, kick them out of housing, and just really depend on the fact that, you know, these folks didn't have resources to fight the eviction, and that their lives were so chaotic that they would just go back to homelessness. And so when I worked at Corporation for Supportive Housing, we introduced the concept of harm reduction and volunteer services. And so the onus really for services is on the service provider. As my friend Kelly Wilkerson used to say, it's our job to make services as attractive and as sexy and appealing for people to want to participate. So that's our job. That's our job as service providers, that you can't sit in your office and wait for people to come down, that you have to go out and you have to be in the community of the housing, and you have to get to know people, and you have to, you have to be available to provide them with a resource that they need, not the one that you think they need, but what they need. So if they come to you and they say, hey, Joy, I need some socks. And I think, oh, well, you probably would do better if you stopped smoking crack and went into treatment. But I'm not going to have that conversation with them. I'm going to give them the socks, right? So then they come back to me as a resource. So when you're doing housing and you're looking at federal, there isn't anything in HUD that mandates people to services. You have to have services available. So HUD no longer does transitional housing. What they do is rapid rehousing and emergency shelter. And now they give you a limited amount of time for people to be in those facilities. So, and they use an assessment tool to determine how quickly and what kind of housing you need. And so in a lot of places, they use a VI SPDAT that will gauge what level of housing folks need, and that will determine your housing match. HUD has required most places to develop a coordinated intake system for chronically homeless folks, so that people are matched with the appropriate housing. If you want to know about Housing First programs, the best place to go is to Pathways in New York. That is the first Housing First program that was ever developed, and it was based on chronically homeless people with mental health issues and substance use, and Pathways leased buildings, apartments, and put people in, and then provided services. And so the whole idea is to engage with folks in a way that they want to participate in services, but it's not mandatory. And so I also worked with a project in San Francisco called the Lyric. The Lyric was the first harm reduction program in San Francisco, and it only took chronically homeless folks with substance use issues and mental health issues. And how they gauged the success of that housing program was not whether or not people participated in programs. They measured how many microwaves were still in the building after 6-7 months. So when I say that, that means that people didn't sell, that half the microwaves were still in place in the building, that people had not stolen them and sold them. They also offered rental assistance. And so that's a tool people can use, especially for people with mental health issues and substance use issues, that we will pay your rent and your bills first so that you stay housed. And whatever else you do with your money, that's what you do. But we will help you to stay housed. And so that's a key program when you're doing housing programs for folks that have substance use issues, mental health issues, and have it be voluntarily. So they would really gauge if people were able to pay their rent on time, then they wouldn't ask them to participate in money management or have a payee. So, and then if people started to get into trouble, they would offer that service. And still it was voluntary. So harm reduction services are all voluntary. And before harm reduction came around, any kind of housing that was provided by HUD was mandatory services. And so with harm reduction, that has changed. I want to say, you know, HUD didn't change that, harm reductionists changed that. HUD didn't wake up one day and say, oh, you know, this is a great idea to have voluntary services. No, harm reductionists pushed for that, and supportive housing advocates pushed for that and said there is no data that says that people are more successful in housing if services are mandated than they are if they're voluntary. And so if you continue to look at the data, you will see that voluntary services, offering people voluntary services are much more successful in keeping people housed. And with housing first is, you know, it's not just one time that you have an issue. It is, we will continue to work with you. And with the coordinated entry system in housing, if you are not successful in one building, that means we will look for another suitable building for you. So we don't give up on you. We don't give up on you. And I believe that before harm reduction came into supportive housing and pushed HUD to change some of their mandates, that we were creating homelessness as well. And that we were taking people in and setting them up to fail. You cannot take people that have been chronically homeless without any kind of structure, without any kind of parameters, and put them in housing and expect them to be successful. It's a setup. And so if you know anything about working with people that have been chronically homeless, it's a transition for them. And there is a program called critical time intervention, and it's a trauma-informed intervention, and it goes 3 months at a time. So that in the first 3 months, this is what you're doing with the person. And then when they're integrated into the housing, and then they're integrated into the community, and then the last 3 months, they are totally integrated into the community and getting resources on their own. And so there are all these other tools that you can use to access harm reduction in housing, or housing first, to help people stay housed. I just think, even with HOPWA, rental assistance, and I just think that, with this model, housing first, rapid rehousing, all of that, is that we put services up front, load them up front, and get people housed. And then the idea is that people become independent and resourceful on their own. And if we mandate services, then we are saying that people cannot grow. that they cannot grow beyond our services. And the whole idea is to help people become independent and part of the community and resourceful. And when they need help, services are available. It's just like if I need help, right? I'm going to go to therapy when I need help. I'm not going to go to therapy forever, you know? And my landlords and my mortgage companies certainly cannot mandate me to go to therapy. And so we really have to look at how policies are set up, look at what HUD's policies are, and then what agencies create as policies. And I always say, if your policies don't reflect your mission and your mission and your vision, because you know how we always have those really flowery mission and vision. We want to meet people where they're at and be successful and all that. But if your policies are punitive, then you're not reflecting what you say your mission is. So I think that's all I really have to say about housing. I think there are a number of resources in the community, and that each one really takes a way to think out of the box in order to be successful in housing the people that we're currently working with. And there are a number of other people on this in this panel, this workshop, that are also experts in this area. And Laura Guzman is one. I can't see everybody, but I just want to say that, you know, there are resources within this workshop for people. Thank you.
Thank you so much, Joy. Thank you so much, Will. Wish we had hours and hours really to listen to y'all speak, because obviously this is a huge topic. With that being said, we would like to go ahead and open the floor up for some Q&A. And we did get a question here just a couple minutes ago from Elizabeth Reynolds. The question is, are these folks provided with cell phones and internet access also, or a way to help themselves and communicate? Sorry. Elizabeth, I don't know if you want to unmute yourself and elaborate on the question, if you're interested.
Yes, thank you. I just wanted to know if, along with the services, if the folks are provided, and the housing, if they are provided either a cell phone and or internet services so that they can be resourceful and kind of help themselves, and also provide them with a means to communicate, because when you're homeless and you don't have anything. And so I was just wondering if these programs help address, or the services provided help address this issue. Thank you.
Most housing programs have internet connections. All libraries have internet connections. I don't know any housing programs that have provided people with cell phones.
Yeah, along the same lines, I would say the same thing. I don't know any housing program that does that specifically.
Thank you so much.
We have another question from Jimmy Borders. It says, any advice on how to get a Hopwa, Ryan White, or other city program to make achieving successful housing priority number one, rather than look at it as a temporary handout? They have to do not a hand up to help better themselves. Basically, it's how to make housing priority number one and not a temporary problem. He also said, your wonderful mindset is an anomaly versus many of the leaders and decision makers I've had to deal with.
I'm not, the goal of HOPWA is to successfully house people that have HIV and AIDS. That's the goal of HOPWA. So anything other than that is a different policy than HOPWA's mandate. When I was in San Francisco and HOPWA first came out, and people were using it like for permanent housing, and I was running a transitional housing program, and I applied for HOPWA funds, and they were like, oh, we want to use this for permanent housing. But I had looked at what HOPWA said, and HOPWA did not exclude transitional housing programs. And so what we did was we applied for HOPWA and we bought a building with HOPWA funds. And it is still in existence in San Francisco. And so I don't, it takes a lot of education for people to really understand what permanent housing is, because anything other than getting people out of shelter and you put them in any kind of program that has a subsidy attached is always subject to being temporary, because we never know where the funding shift is going to happen.
Yeah, and to that point, thank you, Joy. It was wonderfully stated. It's a tough question to answer, but I would say it's advocacy for persons living with HIV, advocacy against the city officials or county officials, whoever's handling the HOPWA contract, and also advocacy against providers, making sure that providers ensure that housing first is their priority. I have met many housing providers around the city of Atlanta and metro area that they don't necessarily consider housing first to be the method to house people, the preferred method to house people. In their minds, they would prefer to offer services first, and if a person is deemed worthy enough for housing, then they give them housing. And that's not the way we should approach this at all, right? So it's advocacy number one all the time, and pushing it out and making sure that we're always putting impacted persons in front, making sure these stories are told, and making sure we're always pushing. That's the only way really to get changes done. My role now is completely different than it has been in the past. Now I am in the federal government, so I can no longer do advocacy work. But I still understand that to be the preferred method to make changes.
The other thing is that HOPWA can be used for capital. And so if there is a housing developer in your area that's willing to do subsidized housing, that is a way for people to have permanent housing, is to use HOPWA as the subsidy along with the city funding and do a HOPWA subsidized base housing program. So it's a third of people's income. And it's not transitional.
Joy, can you hear me?
Yes.
Oh, good. So Joy and Will, I think this is Jimmy. I think where I'm going with this is I hear the rules of HOPWA, I hear the rules of HUD. What we see here is there's a HOPWA waiting list as long as the Grand Canyon. Mm-hmm. The city programs are poorly run. I mean, we've got one here in Phoenix. They answer their phone taking applications 1 day a week. They direct everyone to online. I've called them out to the point where I'm literally being told by the boss, stop rocking the boat. And so I guess what I'm saying is there's something higher. Same thing with, I'm in a Ryan White program. I'm in the ADAP part, but there's programs here where it's like literally pulling teeth, because it's like they don't want to spend the money. They're like, I don't want to do this. We need to spend the money somewhere else. Or they need to go to HOPWA where there's a giant wait list, or they need to go to the city program where it's a cluster, you know what. So that's the kind of problems we're facing. And it's like you go to HRSA, you go to HRSA HAB, and they just kind of look at you like, well, that's a HUD problem. Or, you know, it just gets frustrating. And I hear the advocating, and trust you me, I am advocate number one. You know, I'm just now getting to the point where I'm more about the accountability versus the advocacy, because it's time folks get held accountable for their poor decisions and, quite frankly, their laziness.
So does your community have a housing coalition? If people are receiving HUD, they have to have a, I forget what it's called now, but they have
Continuum of care. The
yes,
continuum of
thank
care.
you,
Yes.
Mara. A continuum of care. And that is where the decisions get made and pushed up to HUD. So if you have to have a continuum of care in order to get
they have all that, but unfortunately the excuses are all the excuses are being accepted. So you're getting Hopper excuses like, well, we have a wait list. What do you want me to do? We only have X amount of funding. Or you're getting the city program that's like, we got all this COVID money. There's only 2 people in the program. We were overwhelmed. And you're getting constant excuses. It's kind of like COVID. We're getting to the point now with COVID where we're like, look, we need to fix this and stop blaming COVID for all of our shortcomings.
I don't know, bro. You know, I'm sorry you live there. And, you know, because
I feel more sorry for the
challenge, it is a challenge if you don't have advocates that are united and kick down doors.
Yeah, well, I just feel sorry more for the clients because our housing market is, I mean, I literally can sell my 3-year-old house for 4 times what I paid for it right now. That's how insane our housing market is. So that's the other excuse we get is, well, we can't pay this rent. We only have X amount of money, or we're capped at this amount of money. This person wants 2 times that for rent. And sadly, they'll get it because this housing market here is so insane right now.
Yeah, it's like
Jimmy, let me ask you a question. Do you know if your city has a HOPWA advisory committee? I know this is mandated for HOPWA funds from the city. They're supposed to be organizing some type of committee to advise them on how to fix their problems.
It's all rolled up into that same program. They've rolled HOPWA in that city program into the same program that's poorly run.
Now, do they have an advisory committee? Because usually
if they haven't, I can check. If they have one, they haven't advertised it.
Right.
That happens a lot as well. But they're supposed to have one if they receive HOPWA funds, and through this HOPWA advisory committee, they can also communicate with HIV housing office at HUD and bring them on. And that's what happened with the city of Atlanta involving this office, and it made some progress.
Are they going to be able? Is there a accountability threshold to where they can say, well, we have a wait list. What more do you want me to do? I mean, how do you approach a problem? Because I could literally tell you, because that's what I've been told.
Yeah, that's an issue of capacity. And with issues of capacity, they're always going to blame the overall housing problems that a city is experiencing. So even though this program is specifically for HOPWA, what they normally do when there's issues like that, like a waiting list, like there is in Atlanta, they will mention the fact that there isn't enough capacity to house people in general. So we can't house people that take on HOPWA services, which is
correct. And that's what happens
here.
They cite that plus the transitional effect that Phoenix has, because once we get to the mini surface of the sun here in another 2 months, everyone leaves and goes to Flagstaff where it's cooler. And then once we go back to where the weather is like now, where it's 75 degrees, they all come back from Flagstaff because it's snowing up there. So we constantly have this ebb and flow of homeless folks. And right now it's through the roof, literally through the roof.
Jimmy and Joy and Will, Laura Guzman, National Harm Reduction Coalition. I was the director of Continuum of Care for Alameda County before joining the coalition. And I want to say that what you're saying, Jim, is true and is resonating throughout our jurisdictions. So in California, I think when we have our calls, the issues are the same. And I just want to reiterate what Joy said and Will said, advocacy is key. Housing first happened because there was parallel to syringe service programs pioneering harm reduction, we were also pioneering harm reduction in housing, which meant we were yelling because our folks were dying of AIDS without being housed, without being sheltered, without getting respite programs. So in some ways, this is the call also for everybody. It's not just to push the continuum of care jurisdictions, but also counties and cities to really elevate their ways to redirect funding. So one thing we're doing in California through our California Harm Reduction Initiative is we're doing PIT surveys, and we're actually starting to quantify, and Marjorie Katz is in this call, and I thank her, that our surveys are now really addressing how many of our folks in syringe service programs are literally homeless. And also we're collecting data about homelessness and overdose, homelessness and tracking what drugs are really impacting our communities. And so I think it's almost like we're beginning again what we did in the 90s. And I really thank Joy Rucker for being such a goddess and a mentor to so many of us, because without that push, and when I mean push, I mean pushing the continuum of care, they're mostly now handled by counties and governments. They have taken away the community's power, which should be involved in those decision-making, has had predicates. So I just want to say, this is an invitation for advocacy again, and this is really pushing the envelope at this point. What local subsidies can we create? How are we going to house the 75% of all of our syringe service programs are literally homeless in California? How are we going to push to show that data? We're going to be actually showcasing our survey with state partners. And I just want to say, there is no easy solution because homelessness is the norm right now. This is what the system is taking upon, our folks staying unhoused. So I just want to push for what Will is saying and what Joy is saying. This is a time to really step up and not just making them accountable. It's really pushing the envelope about what decisions are made, how are we funding? I mean, a lot of our folks need long-term funding of their leases. It's not just temporary. So I just want to plug in to say, this is the moment to take what Joy and Will are sharing for us to really do more organizing.
Yeah, I was gonna say, I don't even want to comment about harm reduction because that's, you talk about taboo. In this state, that's very taboo. So, I mean, it is what it is with that one.
Thank you. Yeah, this is, again, just lamenting that we have limited time. There's so many avenues that we can take in these conversations and calls. I wanted to jump in. We've got another question that was dropped in the chat by Oscar Arellano. And the question was, are there any housing opportunities that prioritize on people who inject drugs?
No. No. Substance use is not a considered a disability. So if you're a local provider, and that if you want to target people that are currently using drugs, then there is a way for you to, if you have private funding, then you can manage your own wait list. But if you are getting federal money, there is no priority for people that use drugs. Stephanie.
What's up, lady? Welcome,
hey,
everybody.
Stephanie. Well, anyone, we don't have any that I can tell, any current questions in the chat. Does anyone have any questions they want to throw out to our panel? I have a question if no one's got anything burning up right now. And it's not so much a specific question, but can you all speak into anything about housing access for people that are leaving incarceration or folks with criminal records?
I know when I was in LA and I worked for Corporation for Supportive Housing, we started a reentry housing program that did in-house, went into the jails, prisons, because California was shifting. So they were releasing nonviolent offenders. And so there were going to be a ton of people coming out that had not been homeless. And so we created this project with partners that went into the prison in the jails to find out who those folks were that were coming out that were homeless, and started working with them before they were released, so that when they were released, they had somewhere to go. Whether that was, bridge housing, but really starting to work, and the project was just in reach. So we started doing in reach into the prisons and jails before people were released, because in LA, Twin Towers, you have to go through Skid Row to get anywhere from when you're released from Twin Towers jail. And so Skid Row is notorious for drugs and alcohol and a bunch of other stuff. And so what they would do is make sure that they were notified when the person was going to be released and pick them up and take them into bridge housing. And so, there are reentry programs that are doing things to help people transition back into their communities.
That's fantastic, Joy. I wish out in areas like mine where there are, non-services, we're out in the mountains of Western North Carolina. I pray for services like that. Please, somebody come into the jail and help our folks, because they get just charged to the woods. Here's a tent, have a good day. $5 in your pocket, okay.
Yeah, and usually
there's
in
no
the
bus, there's
middle
no
of the
cab.
night. Right, in middle of the night. Yep.
I pray for those services. Thank you.
Yep.
Well, I actually, and kind of leading into what you were saying there, Stephanie, one thing I've observed, and anything you can talk about this, is, we have HUD money for housing. We have our continuums of care, but those continuums of care, there's not one model, or I should say, you could go into one city and the continuum of care, just the priorities or the priorities look very different, or the I guess rules look really different. Do you think that a continuum of care could be more successful if there was a national oversight? And if so, how might we go about that? Just a little question.
I think that national oversight can be scary and a little big brotherish. I think that, the continuum of care in progressive cities such as San Francisco and Oakland, thank God there was no big brother mandate on how you do things, because I really do think it's based on the community and based on the community's needs. and based on the advocacy that happens within that community. And so, no, I would not, I would want each community to have their own voice.
I would agree with Joy 100%. I think that having a baseline is important, and that baseline be something like Housing First, but then providing communities the freedom to be able to provide more than that baseline is essential.
Yeah.
And actually, as we say, baseline and minimum standards, I think that might have been the word I was searching for, but I was really curious on your thoughts about that. We do have another hand raised. We
Howie.
did.
Yeah, Joy. Good
Hey,
afternoon,
Howie.
everyone. And this is really a great discussion. Joy, I wanted to get your contact information so that I can send you some info and invite you to a meeting here in Baltimore. Maryland Department of Health, along with the Harm Reduction Coalition, is looking to put something in place surrounding housing for persons who are still actively using. And I think your insight would be a great, just having you there to provide some insight and experience and some knowledge surrounding this would be really, really a great benefit to us here in Baltimore. Thank you. I see it already. I'll send it out to you.
Okay, bro.
All right.
Good seeing you.
And you just gave me goosebumps.
For people that are doing housing, I just want to say that, housing people that are chronically homeless is tough work. It really is. And to get the community not to have stigma, attached to housing folks is really tough. I mean, I'm sure everybody in this workshop is working with people that are really, really struggling. And, for me, we are all on the right side of the issue. And we just have to figure out how to push the envelope, just like Laura said. Advocacy is the thing that is going to change policy. We look at system change. And I have to say that, the work that we did in California was incredibly successful in terms of system change. It was slow, but we stuck with it. And we have, and I'm proud to say that I was part of that process that now has much more inclusive housing than ever.
I also think, Joy, that until we have some sort of guiding principles, I mean, I know Housing First has their model, but to incorporate the systems together, until we have some sort of document that helps bring them together, that we're going to be going through this trial and practice. Oh, that didn't work. Oh, that's too high of a barrier. We really do need something that we can share out with each community, whether it's rural or in the city, so that folks have an idea of what do we do to even get something started that's low threshold, low barrier with Housing First and people who are unsheltered using substances.
If you go to Corporation for Supportive Housing, their website, they have a ton of research, documentation about successful supportive housing and how it saves the city money in the long run, because they have done a number of programs that really target high-end users of systems like the jails, mental health, substance abuse, all of that. And so they have done research and they have papers and they have toolkits on how to really assess whether or not you can do this kind of project. And they have a checklist on all the things that you need to have in order to start this. But there is plenty of documentation out there, especially on their website, about how successful supportive housing is when you provide it to chronically homeless folks and provide them choices in services. And it's way less than jail, mental health, and emergency rooms.
I'm going to go ahead and share two more resources that sort of like do the same kind of thing in terms of giving people information and checklists and stuff like that. One is the National Alliance on Homelessness. It's one organization that is great in providing this kind of information. And then also the National Low Income Housing Coalition. Yeah. These are two organizations that are great resources for anyone who's attempting to try this in their own community. And they're also really responsive and helping you with any questions you may have.
So I wanted to just say the website is the Corporation for Supportive Housing, and they're a national entity. So they have offices across the country.
Okay, I think we are unfortunately at time, but I wanted to thank Will and Joy for joining us today and for their excellent guidance. I want to thank you all for joining us, and we hope to see you in the next part of the webinar series, which will be on the first Wednesday of April. I think that's April 6th. And we will be sending those invitations out at the end of March. So just keep an eye out for that. Thank you, everyone.
Thank you, everybody. Thank you for the invitation.
Thank you.
Joy, it
for
was
the
a pleasure.
invitation. It was a pleasure, Will. Thank you, Billy, Meredith.